My name is Shelby Hatcher, and my pathology is bone tumors. Normally, when diagnosing bone tumors, you would do a bone survey, which is imaging of multiple parts of the body. For the purpose of this video, I'm going to be doing an AP and lateral humerus due to the fact that the most common malignant bone tumors can be found in the upper arm. The first thing I'll do is get my patient from the radiology department and ask for two main identifiers, which is full name and date of birth. Then I will bring them into the room and ask them for a history, like if they're having any swelling or pain in the area that we're imaging, if they have had any fractures before. And after that, if it is a female, then I will ask if there is any chance of pregnancy. If I were to do a bone survey, I would ask the patient to undress completely except for their underwear and put a gown on, but for the humerus, if it was a female, I would just ask her to take everything from the waist off up and gown in case her bra strap would be in the picture, but for a male, he wouldn't need to do so. Once I have my patient in the room and make sure that they're shielded, I'm going to set everything up. So I have a 14 by 17 inch cassette in the bucky lengthwise. I made sure that I had a 40 inch SID to the cassette, and I made sure that my tube was in D10. When I go to position my patient, I'm going to ask her to slightly abduct her arm and supinate her hand. I want to make sure that I'm centered to the middle of her humerus. And I want to make sure that I have the head of her humerus and both epicondyles in the image. I also want to make sure that they're parallel to the image receptor. I'm going to put a right marker on the lateral side of her arm, and I'm going to collimate down, just slightly. Next, I'll measure her arm. She measures an 8, so I'll go set the control panel, and I'll make sure that I have a small focal spot and that it is on the wall bucky. For my lateral projection, I went and got a new cassette. It's still 14 by 17, but this time it is crosswise. I made sure that I was still at 40 inches and my tube was still in D10. For this projection, I'm going to have her raise her arm. Again, I want to center to the mid-humerus, and I want to make sure that I have the head of her humerus and both epicondyles. I want to make sure that they're perpendicular to the image receptor. You can relax your arm for a second. I'm going to crop all this out, but it definitely wasn't just in your own shoe. Okay, now put your arm back up there. Once I make sure that I have all of her anatomy, again I'm going to use a right marker. I'm going to collimate just a little up and down. Again, I will measure her arm. Time she measures 9, so I'll go change my factors on the control panel, again using a small focal spot and the wall bucky.